What's up, my friends? Welcome to this episode of the Whole Health with Rob Carney Podcast. And on this episode, we have our guest, Dr. Michael Belkowski. So, Dr. Mike is the founder of BioLight, which is a red light therapy device that we can use to improve many aspects of our health. So, Dr. Mike really goes into, what can we do to improve our health using BioLight? When's the best time to use it? What are some common myths? Are there any downsides to using red light therapy? What about looking at it because it's really bright? Can it harm our eyes? He talks about all these great questions and more. And he talks about how it's really good for the mitochondrial production of ATP in our body, reducing inflammation, circulation, and much more. So stick around to the end to get a special discount that you can use on your own BioLight device by using the discount code WHOLEHEALTH, and we'll tell you exactly where to do that. So sit back, relax, and here's Dr. Mike. Dr. Michael, welcome to the show, my friend.
Hey, Rob. How's it going, man? Thanks for having me on.
It's going very well. So I was introduced to you by a mutual friend, Troy Casey. He recommended I get out to you about the BioLight, who you're the founder of. And so I learned a lot about red light therapy from him and from, doing my own research. And especially being out here in New England, it gets a little cold in the winters, and sometimes you get that a little bit of that seasonal depression. And so this year I was like, I'm going to get on top of this and get into some red light therapy. And so I reached out to you. I've already learned a lot from your page and all that you're sharing. So I'd love to just start by you sharing your story. What got you interested in health in general? What got you into red light therapy, and what's the story?
Yeah, I guess to tackle that initial question, what got me into health? I don't know. When I was a young kid, it's not like I was the most healthy kid in the world. I ate my fair share of candy and drank my fair share of pop. But I guess it got to a certain degree where health became really important to me. And I guess that was probably closer to the end of high school, early undergrad. There was just a flip the switch. I don't think there was this aha moment or anything, but my mom was a pharmacist, so she was in the healthcare field. I was always really into physical fitness, but I wanted to do something more than be a personal trainer. So being a physical therapist seemed like the next sensible step. So through undergrad, worked my tail off to get into PT school and made that happen. And at the end of, after I graduated from PT school at the University of Montana in 2016, my initial plan was to work a couple years locally in Missoula, Montana, and then go travel to Australia, because that's kind of like the mecca of physiotherapy, and really that's where a lot of the research comes from for physical therapy. But my first certification after PT school was dry needling, and so you don't learn close to nothing about that in PT school, and I hope that changes soon. But when I took that course, I was blown away at how profoundly it works. People can walk in with acute pain, with chronic pain, headaches, migraines. It can be anything. And if it's dry needling is used correctly, or the certain strategy is used correctly, they can walk out with 50, 75%, 100% pain reduction, and it's real pain relief.
Explain dry needling, because is this acupuncture for anyone listening that isn't familiar with dry needling? Can you just explain a little bit about that?
Yeah, for sure. I mean, dry needling, I would argue, is very underutilized, and most people don't know about it. Literally the exact same thing, exact same needles as acupuncture, but the treatment philosophy, the education is where they kind of deviate. Of course, acupuncture has been around for thousands and thousands of years. Dry needling was more or less developed, in the late 60s, 70s, 80s, and now it's starting to become a little more popular. I guess from a layman's perspective, acupuncture, for the most part, the treatments are superficial. They don't go into the muscles. They're treating the energy fields. They're trying to, normalize your energy. They have the meridian lines. Whereas with dry needling, I'm more so trying to treat the nervous system. More often than not, I'm going all the way to the bone with the needle. But again, the whole point of dry needling is to reduce inflammation and improve circulation to wherever you're having pain. And really that's where the parallel with red light therapy is. And that's where I kind of had the aha moment with red light therapy. So I've been using, kind of going back to dry needling, I've been using that for, over 4 years now. And that's really what I've cut my teeth on, because Missoula, Montana is one of the, if not the most PT, physical therapy dense areas in the country. So for me to graduate in 2016 and want to open my own practice 5 months later, I knew I had to be different. I knew I had to offer something else that was unique, yet was effective. And so when I took that dry needling course, I couldn't believe how underutilized it was because of how powerful dry needling is. For example, going into that course, I had a left hip flexor issue because I had an avulsion fracture when I was a freshman in football in high school. So that was about 11 or 12 years prior. But since that avulsion fracture, that left hip had always been tight, tight, tight. If I started to run, or I was a hockey player, so if I started to skate again, that left hip would talk to me. It would be achy, it would be sore. And going through physical therapy school, I would try the different techniques you learn. You stretch this, you mobilize that, you do your self-treatments at home. And that would help a little bit, but it never really moved the dial. And in that dry needling course, the whole weekend you practice on each other as you're going through the course. So you get your whole body needled by the end of the weekend. And when my partners got to my hip, it's about, 3 to 5 minutes of needling. You do your area and you're done. But when I got off the table, my hip was like 100% back to normal, and it's never gone back again. And that was, 4 years ago. And same thing, my left shoulder had a little bit of a pinch. I was a pitcher, I was a quarterback, probably not great mechanics. So I had a little bit of a pinch going into that course. Same thing, my partners got to it, and it's never hurt again. So those were my aha moments for dry needling. Like, this is real. I need to move forward with this and offer this to the community. And so 4 years later, really, that's what my practice is built on. People come to see me specifically for dry needling. And that's a long-winded way, again, of saying that's the parallel with red light therapy. Whereas dry needling, it's non-invasive technically. Yes, there's a needle going in, but it's non-invasive. It's very safe, and it's very effective. So it's the best of all worlds. And the results are long-lasting. They're not this placebo effect. It's not this, putting a patch over the problem. You're treating the root cause because, again, you're reducing the inflammation. You're improving the circulation to whichever area is lacking or has too much inflammation. That's literally what that's literally what red light therapy does in a nutshell. Aside from some things we'll talk about, I'm sure, ultimately it drives down inflammation, red light therapy, and it improves circulation, both, microcirculation of the blood flow and then the lymphatic system. So that's why people, again, with acute pain or chronic pain, tight muscles, athletic performance, can have such drastic results, albeit it just takes consistent treatments. But again, it's non-invasive. It's easy to use. There's really no negative side effects. There's no contraindications in the research. So, the sky's the limit with red light therapy, and that's in the research. That's not hyperbole. There's over 5,000 peer-reviewed research articles on these various areas that red light therapy can help in. And I think it would be good for us, of course, to go into the mitochondria, because that's really where the rubber meets the road with red light therapy. Because if we talk about how it can help with hair health, skin health, sleep, anxiety, depression, joint health, heart health, brain health, thyroid health, the list goes on and on and on, and it starts to sound like a snake oil pitch because red light therapy is touted to treat all these things. It's proven in the research, but when you understand what red light therapy is treating, the mitochondria, then it starts to make sense. And so for your viewers, I don't know if they're familiar with the mitochondria, but it's an organelle that's in every single cell in our body. There's thousands of them in every single cell in our body outside of red blood cells. And so red and near infrared light, which is what red light therapy consists of. It doesn't consist of the mid or far infrared, which is seen in saunas, but the red and the near infrared specifically stimulates an enzyme in the mitochondria that ultimately leads to an optimized function of the mitochondria, which is important because the mitochondria is what produces our energy. And so if you're able to enhance or normalize your energy levels, you're going to have more capabilities to heal. You're going to have more capabilities to, again, reduce the inflammation, recover, and So it
So
makes sense then. Go ahead, Rob.
yeah, I was just gonna ask, so what is it about the red light and that specific wavelength that is, producing these effects? Like why can we use, let's say, green light or blue light for anyone listening? What is it about red light that really makes a difference in that near infrared frequency?
Sure, yeah. I mean, it comes back to the cytochrome C oxidase, which is the enzyme. It's the chromophore or the photoacceptor on the mitochondria that's specifically stimulated by this red spectrum and this near infrared spectrum. It's not like the technology invented this wavelength in order to stimulate the mitochondria. It's just the way that our biology is. For all intents and purposes, it could have been blue light or it could have been green light, but the photoacceptor on the mitochondria happens to be stimulated and excited by red and near infrared light.
So where would we see something like that in nature? Like where would we be seeing this frequency in nature of red light?
The sun. I mean, it's just part of the full spectrum sunlight. So the sunlight consists of all of the visible spectrum, but then of course the ultraviolet rays and the infrared rays, both of which are invisible to our eyes. So when you go out, especially early in the morning, if you go and watch the sunrise, that's where the sun's going to be, have the greatest density of red and near infrared light. So for people that want free red light therapy, all you got to do is go watch the sunrise in the morning, and the sunset in the evening, and there's your red light therapy for the day, in a short sense.
I love that. And one thing I want to kind of go into that with is, people talk about, oh, it's a bad thing to look at the sun. It's a bad thing to look at the red lights. But I've also seen studies that it can be beneficial to look at the light. So what is your view on, actually looking into the light? How does that help our retina or any other areas of the eye or just overall health?
As far as red light or the sun or both?
Both, either or.
So if you're going to do the whole sun gazing technique that you're talking about, I think it has to be done as the sun is rising. Of course, you wouldn't want to do that in the middle of the day when the sun's intense, and then you have all those UV, more blue light, that type of thing. So if you're going to do that, speaking, to what you're talking about, absolutely. I mean, I did that this morning. I've been doing it every morning I can, because I think you can attest to living at the latitude you do. You don't get sunny mornings every single morning. So every morning, and this comes from Dr. Jack Cruz. I don't know if you're familiar with him, but I'm outside barefoot, so I'm grounding. I'm looking towards the sun. I'm looking directly at the sun, especially as it's, just coming off the horizon. And I'll do that for 10, 15, 20 minutes every single morning that I'm able to get some sunlight. And I shouldn't really say every time I get sunlight, because even when the clouds are there, you're still getting the red and the near infrared light. So yeah, and then speaking about the red light therapy, there's plenty of research that's starting to roll out that red and near infrared light is absolutely beneficial for our eye health and for the retinas. Whether it's improving the rods and cones, whether it's ultimately mitigating or reversing age-related macular degeneration, the research is out there. It is beneficial. And that's what I get a lot of questions about is how to go about treating your eyes with a red light therapy panel. And that gets a little tricky because as an owner of a company, liability comes first and foremost. So of course I'm going to say protect your eyes. And that's what I tell people when they email me or they ask me that question is you should be protecting your eyes, but I'll tell you what the research says and I'll tell you what I do personally. And then you can go forward and make your decision from there. But with our panels, we provide protective eye goggles. But ultimately, I'm providing people with the information and the education so that they can make their own personal educated decision and go forward with it. If they don't feel comfortable with it, by all means, close your eyes, put the goggles on. You're not going to do any harm by doing that. But if you look at the research, it sure does show that red and near infrared light is beneficial for eye health.
Love it. And so while we're on that topic, what are some other myths that people have about, red light therapy? Some people say, it's not good to have it on your face. It's not good to have it X, Y, and Z. What are some of the myths that you are commonly coming up against with red light therapy?
The first thing that comes to my mind when you say that, it might not be a myth. I think it's just more of a mentality, and that's more is better when it comes to red light therapy. And I think that's where a lot of companies have it wrong. And I don't know if that's just because it's a lack of education or it's just that mentality of more is better. But I think most people that do red light therapy and they don't see results is because they're over treating. And I guess that's, the caveat to that is the beautiful thing of red light therapy is if you overtreat, there's no negative side effects. You're just not going to get the results you're looking for. But what I like to harp on whenever I do like Instagram lives or podcasts and I'm trying to educate people is that there really is this concept called the biphasic dose response, which is essentially a bell curve. And on the left side of that bell curve, you have where the dose is too low. And the dose means your body's not absorbing enough joules, enough light energy. And so the dose is basically three variables: the light irradiance, which is how much power is your device putting off, what's the distance you are away from the panel, because the further you are away, it's kind of exponential. You're going to lose more and more light power and light irradiance. And then, of course, the duration of the treatment. So the dose, if it's too low, which I would argue very few people do, it would be any combination of your device isn't powerful enough, you're too far away, and or you're treating for too little of time. But I think by far most people are on the other side of the spectrum where they're probably just over-treating duration, but maybe they're too close and relative to the power of their device. So that's really why I developed the red light therapy treatment protocols ebook, is to really take the best of the current research, see what those different pieces of research are doing, how many joules are they treating with what population for what's your ultimate goal with red light therapy. Is it sleep quality? Is it skin health? Is it athletic performance? Because all of those are going to take slightly or quite different protocols. For example, if you're doing anti-aging skin health, you want to be about 18 inches away, and 60 to 120 seconds is more than enough. If all you're going for is like getting rid of the wrinkles, keeping your skin nice and plump, that's all you need. Whereas if you're treating, let's say, anxiety, depression, you want to be using near infrared light, because near infrared light penetrates deeper, which we can get into more specifically if you want. But then you want that facing your frontal lobe. Some research shows that the right lobe is actually more efficacious than the left. And you'd want that on for 8 to 10 to 12 minutes, because you need that light to penetrate your skull and get deep enough. And you need enough energy to get to the brain and to the nerves to stimulate that effect. So even those two treatments alone take profoundly different protocols. So the blanket statement that a lot of companies or a lot of people are touting, that 30 minutes a day is going to treat, X, Y, and Z, I can't buy that. 30 minutes is a lot to me, unless you're standing a decent distance away. Will you ultimately accrue benefits? Probably, because again, you're stimulating the mitochondria, but chances are you might be overstimulating it, especially if you're doing it every single day, which I would argue you don't necessarily need to do. So that's maybe another myth, is that people think they have to do it every single day. And more or less, it's like exercise, where you're stimulating your body, you're causing a stress response to a small degree.
Right.
If you exercise every darn day, you're not giving your body time to recover, adapt, and come back, with more resilience. And that's really what you're doing to your mitochondria, is you're causing this hormetic response, where you're stressing it. It's producing more reactive oxygen species, which in small amounts is a positive thing. Your body reacts, comes back, builds it stronger and more resilient. So the next time you do it, it's more able to withstand those stresses. So, I mean, those are a couple of the myths, I guess. And that just ultimately comes down to the mentality of more is better.
Yeah, I like that. And I think the one piece you touched on is the hormetic stress. And, for me, hormesis is just something I think all of us need to really put extra attention on, especially in this age of chronic stress that most people are living in. Having acute sources of stress, if we can choose our stresses in the acute form, that's going to make us much more adapted to this life of chronic stress that we're living in. And that's what I've really found, with ice baths, that I really love cold exposure. I love hot exposure, but for me, I don't have a sauna. And,
Yeah.
now gyms are closed down. So to me, I was like, all right, so it's getting to be winter. I want to have some heat, some light in my life in New England
Yep.
here. And that's where I turned to red light therapy. So you mentioned, the sun gazing in the morning at sunrise and then also at sunset. So would that be the optimal timing to do red light therapy, first thing in the morning or right before bed? Or what is your thoughts on timing for the red light therapy?
Ultimately, this is almost the answer to every red light therapy question. And this is the answer we got in physical therapy school for every single question. And that is, it depends. If you're going for circadian, if you're going to normalize your circadian rhythm, probably, with a caveat that red light therapy works differently for different people, for different bodies. Some people find red light therapy extremely calming, extremely relaxing. But if we kind of go back to the story of the mitochondria, you are optimizing the mitochondria, which ultimately do produce more energy. So you might get energized by red light therapy. So if you're doing red light therapy right before you go to bed, and all of a sudden you're getting energized from stimulating the mitochondria, that's probably not going to lead to better sleep. So that's why with the sleep protocol, I say do it at least an hour before you go to bed so that you can kind of understand your body, see how you respond to red light therapy. If you find it very relaxing and you can do it 5 minutes before you go to bed and it actually helps you, by all means do it. If you find that it energizes you, then you need to do it an hour or 2 hours before you go to bed so that you don't let that stimulation put off your sleep.
Love it. Yeah, I think as you said, it comes down to everything. It's what does your body need, and how every individual acts or reacts to any sort of stimulus is going to be completely independent on that individual. So I think that's kind of the, general suggestion I give to everyone. It's like I work with a lot of, organic superfoods. Oh, when's the best time to do this? We'll try a
Yep.
few different things. So let's see what feels best for you. Because
Right.
like you said, it may be like for me, I like to have in the morning. I like to break my fast with a green juice, but some people may say,
Yep.
hey, I like to do that after dinner because it helps with digestion. By all means, use that as well. And so that kind of leads me to my next question in terms of this. Maybe it depends on the person, but for part of what I do is I like to do, as I said, a lot of cold therapy, and I host a group called Ice and Iron. So we do working out, we do breath work, working in with Tai Chi, we do ice baths. And so
Yep.
I am going to begin integrating the red light therapy into that practice that we're doing or that event that we're hosting. So would you say that red light therapy would be best done before the ice bath, after the ice bath, or is that just it depends on the person?
That's a good question, because that kind of makes me think of what I do with my patients sometimes, and that's red light therapy. Do you do it before or after hyperbaric oxygen therapy? Because I have one of those chambers in my practice. So some people would argue doing it before is better. Um, and the reason, and this is the person that like owns the main hyperbaric chamber company, I believe they said to do red light therapy before because the red light therapy causes vasodilation. So maybe you'd be more open when you go into the hyperbaric oxygen therapy. But the HBOT, hyperbaric oxygen therapy, actually causes vasoconstriction. So I'm wondering, does that vasodilation actually hold up when you go into the chamber? So I actually prefer doing the red light therapy after to oxygenate your body in the HBOT, come out, and then get that vasodilation and then stimulate the mitochondria. I don't have any research to back that up. I'm just thinking at the cellular level what's
Right.
going on. I think you can go either way. So kind of back to your question with the CT, would you do it before or after? Well, CT causes that initial vasoconstriction, of course. Then you get that nice flush in the vasodilation. So I think feeding into that vasodilation post CT with red light therapy makes the most sense.
Yeah, that's kind of what I was thinking too. It's also a way to heat up the body afterwards, 'cause especially as I
Yeah,
said,
for sure.
entering these New England winters last year, I think it was January, it was 16 degrees at one of our events, and people are getting the ice baths, and it's easy when you're in there because you got the adrenaline, everyone's hyping you
Yep.
up, and then once you get out, it's like, holy shit, I got to warm up. So
Yeah.
that's definitely something that I'm really looking forward to with this. And so on that note, just for overall body wellness, what's the best area of the body to direct the red light therapy on? Obviously, it's good to do it in different areas for different reasons, but for a general blanket statement, for someone who's just says, all right, I have 5 minutes to do red light therapy every day, and, I just want to get healthy. I'm already pretty healthy. I just want to optimize my health. Would it be the
Yeah.
chest? Would it be the face, the back? What's your thoughts on that?
So this one doesn't necessarily depend, we'll say, because if we think about what red light therapy does, I'll keep repeating this concept, is we're optimizing the health of the mitochondria. So if you're trying to get the biggest bang for your buck, then you're going to want to target the most mitochondrial dense tissue, which is our brain and our heart. While there's not as much research looking at the heart for whatever reason, there's still positive benefits. But if you had to choose one place, I'd probably go with the brain. Because if we look at the overall health of the country, our brains aren't doing too well, with
Right.
Alzheimer's, Parkinson's, that kind of stuff. If we look at our modern lifestyles, we're rarely outside. We're typically in home under a roof. We're at our, wherever we work under, fluorescent lights. We're not getting that full spectrum sunlight. So we're mal-illuminated, if you want to, go with that term. So our bodies are literally malnourished because we're not getting enough light. And a lot of that comes down to our brains aren't getting enough nutrition. Part of that's the vitamin D, but then part of that is the red and the near infrared light. Our mitochondria are being malnourished of their nutrients and what they need to work most optimally. Tongue twister, apparently. So if I were to choose one spot, it would probably be the brain. Your brain is precious. You want to keep your cognitive ability sharp, and it's one of the, if not the most mitochondrial dense tissue in our body.
And so my next question on that note is, does hair block the ability to absorb red light? Let's say I have a full beard and I've got a lot of hair on my head. Is that going to be blocking some of that, or is it able to penetrate through the hair to, get to the skin and the mitochondria and really stimulate all that?
I mean, it's definitely not going to, it's going to be able to penetrate through it, but you're going to have some refraction of your hair or of your beard or what have you. So that's why the research, when it looks at anxiety, depression, a lot of it's the forehead. That's where we have our executive function and a lot of personality. Right. But then we don't have as much hair there. There's not going to be as much refraction. You're already going to have some from your skin. Right. But the hair is going to add that to that a little bit. But definitely not the end of the world. I mean, if you're using near infrared light, that's going to penetrate up to 1.5 inches regardless. So let's say you have like a shine or your recharge, and you can put that, really close to your skull, and you're going to penetrate through the hair. So it's not the end of the world. But most of the treatments are going to be, towards the forehead anyway with the brain.
Cool. And then another interesting area, I was reading Ben Greenfield, Boundless book, and he talks about putting on the genitals and talking about how for men that's really good for boosting testosterone. Have you seen research into that realm? And if so, what's the protocol for something like that?
Yeah, there's very little research to back that up currently. Right now, it's just a bunch of anecdotal evidence, which is not a bad thing, but it's not the strongest evidence. You have enough of these anecdotal, pieces of evidence, all of a sudden, maybe it holds some truth. I actually had a customer who, he was a professional athlete, and I think he used Wellness FX to track his hormones and whatnot, the past 4 or 5 years. And he marked when he started using red light therapy, like you said, on the genitals and his whole body. But there was a major spike in his testosterone whenever he started using red light therapy. With whatever metrics he was using, his testosterone was mostly in the 400s and 500s. But when he started using red light therapy, now it's up to the mid to high 600s.
Wow.
So it's tough to ignore those numbers. I just think there needs to be more high quality research looking specifically at this to really decipher how much water that holds. Because right now I've tried to look through the research, and again, it's mostly anecdotal. A lot of it might be on mice. So it's just not strong enough for me to say, yes, it does. But like you said, Ben Greenfield touts that it does. A lot of other biohackers do. So, I'm open to the, concept that it does work. I'm just not sure. There's just not enough for me to develop a protocol. That's for sure.
Right. Yeah, and I think it is interesting too, because I was thinking the other day, as I was sitting out in the sun, it was like, my lower body doesn't get a lot of sunlight. Like I go shirtless all the
Sure.
time, but I'm wearing shorts all the time. So,
Yep.
thinking about, as you said, areas that are really large muscles, like my upper thighs don't get a lot of sunlight. That's been kind of an area I've been really targeting with the red light is,
Yep.
doing things that may not be socially acceptable for me to walk around naked at my house or in the park or whatever. So I definitely found like, it does feel great to have it on the upper thighs at the very least, which is a very large muscle in our body.
Yep.
And, you mentioned that in terms of, for one area, we're going to target the brain. But I want to kind of get into injuries here and how this can help with injuries. What would be the protocol? Let's say I have a shoulder injury. Am I going to do, chest, like chest and front shoulder, and then back and back shoulder, side shoulder? Am I just going to hit it at every angle for a few minutes, or what's your thoughts on injuries and how does that help with the injuries?
Well, it's more than likely going to accelerate the healing process. Kind of like dry needling, you're going to help reduce the inflammation and improve the circulation. And that's where injuries can kind of be slower healing or even become chronic, um, is if they're not properly treated or healed initially, because that's where you have hamstrings that are easily become chronic. The muscle gets strained, the muscle gets torn, uh, then it becomes calcified over time because it's not, properly treated or healed. And then you have that poor circulation, whether that's to the muscle or to the nerves. If it's the nerve, then it's going to be hypersensitive, and then you're going to get that. It's a lower threshold to cause pain signals to your brain. So really, again, that's where dry needling, but more importantly, what we're talking about, red light therapy, it's so important for healing injuries, is because it's going to, again, reduce the inflammation, improve circulation. So let's say you have a bum shoulder, I would hit it from either side, like you said, front and back. The typical protocol would be red and or not and or red and near infrared light, about 6 inches away, 6 to 10 minutes. Now do that to the front and then do the exact same protocol to the back.
Love it.
Again, not every single day necessarily, 3 to 5 or 6 days a week. I would kind of stack more treatments early on and then maybe separate them as a week or two goes by. Just like you would with physical therapy or whatever. You want to kind of give it a little more initially, but then spread it out more as time goes on.
Right. Makes sense. And then just another personal question. My mom has rheumatoid arthritis. So for someone who is that, it's a complete full body immune overactivation, but specifically she has a lot of swelling in the knee. So her knee has been swollen like a softball. We've been doing a lot of things
Yeah.
that have been helping with it. But for something like that, would you recommend a full body treatment for something like that? Or would you target, the symptomatic area, which is the knee in this case?
But does she have full body rheumatoid arthritis?
It's achy, achy shoulders.
Whole thing?
The knee is the worst.
Well, I mean that you could probably go either way and get results. If the knee is by far the worst, target the knee. Um, Again, it's going to reduce the swelling via inflammation, improve circulation. And kind of back to dry needling. Dry needling is amazing for just what you're talking about, big swollen joints or what have you, sprained ankle, sprained knee, whatever. Because the reason it's swollen is all the vasculature, in this case, especially the lymphatic system, is vasoconstricted. And that fluid, that swollen joint is not going to release until there's some sort of a reason for that microvasculature to vasodilate. Once it vasodilates, then that fluid is going to be able to actually go somewhere. It's going to leave the joint. It's not going to feel as compressed. The pain's going to reduce. So I'm just thinking red light therapy will help. It's better than nothing. It's not as like spontaneous as people can walk in with a volleyball of a knee and it can leave as a golf ball or smaller, if you will. But with consistent treatments, you are going to see results with that swollen knee. If she's having stuff all over the body, a full body treatment would be very effective and efficacious in that sense, because you just want a systemic anti-inflammatory. And if you can reduce the inflammation, across the whole body, a lot of good things are going to happen.
Awesome. Yeah, love that response. That's kind of what I was feeling it too as well. So definitely we'll get her on that protocol. And
Yeah.
so my another question I have for you in terms of the red light therapy, you mentioned dry needling and sun gazing. What are some other techniques that you do, in addition to the red light therapy? Are there any other little biohacking tricks that you use or things that you use to optimize your health? You mentioned walking barefoot. What things do you utilize on a regular basis just to optimize your health, whether that is complementary with red light therapy specifically or just in general?
I mean, those are kind of the nuts and bolts. Grounding, at least 10 to 15, if not 30 minutes or more, as many days a week as I can. Sun gazing, sunrise and sunset as consistently as possible. I do have a sauna outside, so when it's not summertime, um, living in here in Montana, there's lots of opportunity to use that. But those are kind of the nuts and bolts. I think as long as you're optimizing your light environment, you're getting in touch with nature. And that's another thing. I try to get outside as much as possible because I live about half an hour from my practice. And so there's a lot of time in the car, but and a lot of time in the office and a lot of time at home. So as much as I can, I get outside. I like to hike as much as possible, just be out in nature. And Other than that, I take some supplements, but I'm trying to almost get more and more away from that and let my body kind of be more in touch with nature, the sun, the magnetism of the earth, and then clean water.
Love that. Yeah, I think it's really important to, kind of focus on the basics. I think we've been very out of touch with the basics of, being a healthy, happy human, which is really comes back to tuning into nature. What is nature doing on a regular basis?
Yep.
Like you said, like the water, I think is huge. Like I've seen people with major improvements to their health simply by switching to spring water. They're drinking,
Yeah.
tap water or a Brita filter, which, Brita filter is better than nothing, but compared to
Hmm.
spring water, that's night and day there.
Yeah.
So I really appreciate, that approach is just going back to the basics. So,
Well, kind of like what you're doing or about to do as far as jumping in a river. I mean, I live about 50 yards away from a river, so um, in the spring it's way too high because we're getting the glacial runoffs from the mountains. But from now through April or so, as many days a week as I can, I'll go up to my neck. And when I first started this, I didn't start this until really last year, a year ago in October. I couldn't. I could only get into my belly, and it was like 15, maybe 30 seconds. But by the end of this spring, I could be up to my neck for about 3 to 5 minutes.
nice.
And so I mean, there's a lot of health benefits, like you well know, as far as the cold thermogenesis, and then combining that with red light therapy, or just even being out in the sun. Because when you get out of the water, you're gonna have all those goosebumps, and if you let your skin be exposed to the sun, you're actually gonna absorb more UV light, which there's numerous benefits to that too. So, yeah, the cold thermogenesis is another big one.
Yeah, I love as I said, the hormesis. I think that really focusing on that and trying to get, one hormetic effect each day at least, I think is really
Sure.
kind of a big target of mine. And so Mike, I want to allow you to, wrap up by sharing what other things are you up to? How can people get in contact with you? What other takeaway messages do you have for people that are, interested in getting involved with red light therapy? Like, where do they start? I know you have a bunch of different size options on
Sure.
your site. What's the best way for people to get started with red light therapy? The best way to learn more about you, and the best way to, just make the most out of red light therapy?
Sure. Yeah. If people, just have a lot of different questions or they don't really know where to get started, by all means, reach out to me uh, either via, email, which is info@biolight.shop. We have our Instagram page, biolight.shop. Feel free to send like a direct message. And I'm pretty darn responsive and more than happy to answer any and all questions as they relate to red light therapy, because it is such a it's not a new technology. It's been around for decades and decades, but it's very new to the public and to the potential health and wellness benefits. So of course there's going to be a lot of questions. Safety, how do I use it for this? So again, I'm more than happy to kind of talk through with people and help them decide is red light therapy for them? How can they best use it for their health and wellness goals? And then, like you were saying, we offer different sizes. So there's a smaller portable one, which is also perfect for spot treatments, meaning if you just want to treat your brain or you just have like a specific injury, we have a couple sizes for that. If you know that you're going to want to treat your full body, meaning you really want that full body anti-inflammatory and keeping those things at bay, we have sizes for that. So our website's www.biolight.shop. So people can kind of peruse there. We have a little chat box where you can, ask questions there, and I'm on the other side. I'm answering those questions. So there's a lot of different ways to get a hold of me. And again, I'm more than happy to answer any questions and educate, because at this point, there's a lot of questions from people that have heard of red light therapy for the first time. So education is pretty important about it.
Awesome. Yeah, I love that. And that's why I've been so grateful to connect with you. So to anyone interested, feel free to reach out to Mike on Instagram, reach out to me. I have a discount code for our listeners here that you can go in there and use the discount code Whole Health, all one word, WHOLE Health, and you'll receive a discount on your red light therapy. So Mike, I want to thank you so much for your time today. Thank you for, answering a lot of questions I had, and really, like you said, just being so responsive and so receptive to answering my questions and really walking me through this and supporting me along the way. So anyone who did not catch Mike's contact info, I'm going to put that in the description box here so you can look for that along with the discount code and all that type of stuff. So Mike, thank you so much for being here, and I'm looking forward to a journey of healing together.
Sounds good, Rob. Appreciate you having me on, man.
All right, everyone. Thank you for listening. Thanks, Mike. Peace.
Take care.
Thank you for listening to this episode of the Whole Health with Rob Carney Podcast with our guest, Dr. Michael Belkowski. So if you want to learn more about the red light, the BioLight with Dr. Mike, you can go to biolight.shop on Instagram, or biolight.shop is also the website. So I'm going to put that link in the description box here. And remember, when you go to buy your red light therapy device, use the discount code WHOLEHEALTH to save 10% on your entire order. And if you have any questions about the BioLight, about red light therapy, reach out to me. I'd be more than happy to direct you to some good resources, or reach out to Dr. Mike directly on biolight.shop on Instagram. And for all the other great superfoods, biohacking tools that I use at Whole Health Connections, you can go to wholehealthconnects.com and search through all the great superfood nutrition we have there, all the cool podcasts we have from other guests, and just a lot of fun things that I've really brought together to make it as easy for you as possible to optimize your health. So I want to thank you so much for listening. Thank you for your support, and I look forward to the next episode.